Good evening from New York. I'm Selwyn Collins, your host of CWS Conversations with Selwyn. Tonight our guest is Dr. Nathilee Caldeira, a gem of our soil, those of you who are Guyanese. And as you can imagine, I'm very proud to have her here this evening, for example. But let's take a short break, and when I return, I will introduce you to Dr. Caldeira. We are back. I'm Selwyn Collins, your host of CWS Journeys. The wonderful lady next to me is Dr. Nathilee Caldeira. Dr. Caldeira received her PhD in clinical psychology from Adelphi University and completed her doctoral internship at Columbia University Medical Center. She has been providing consultation, training, individual couples, and group therapy services for more than 15 years. Dr. Caldeira.
Yes.
If you were not a clinical psychologist, what would be your career today?
I would probably be a diplomat.
Really?
Yeah. Growing up when I was a young child, I actually wanted to be a flight attendant. And because I wanted to travel. My parents really instilled in us a love of travel. We lived in many different places in Guyana. And so even though I had never gone on a plane, that's what I wanted to do. But then I found out that I'd be spending most of my time on a plane or, in hotels. And so I wanted the interaction of, talking to people, listening, helping with problems. And so I was also very interested in politics, how the world worked. And so I thought, why not work at the UN? So if, that was another dream I had. Yeah.
What memories do you still savor as a 9 and 15-year-old child growing up?
So at 9, we were living in Ituni, which is a small mining community outside of Linden. So for those who know that area. And so lots of memories of playing, being connected in many ways. I have such great memories of, Sunday afternoons, it was going to the cinema, we were at the school, community events. We had, market days. There were special days when there were fresh fruit day, the meat day. We knew the day that, Mrs. Austin was going to bake fresh bread. So those are really, special memories that I have from 9. Running in the sand, playing with my sisters, learning for the first time how to cook rice is a great memory I have. My mom teaching me how to cook rice. But I would say, just enjoying nature, really. I was born in Pomeroon, and my parents left probably when I was about a year old. but we did a lot of traveling, visiting the Pomerone during like the August holidays. And so really love to travel, love nature, animals. And so at 9 was still enjoying that, you know, the idea that we're in a different community, we're learning about, you know, what goes on there. Yeah.
And at 15?
At 15, so probably the special memories I have from that time was, you know, being at high school. But I would say probably my memories of badminton. I played badminton for a long time, mostly for fun. But at about 15, I was representing Guyana at the Junior Caribbean Badminton Championships. Yes.
Wow. Wow.
And so I have special memories of being able to travel again to a different country, being able to, you know, meet people from different countries, enjoy competition. So those are some special memories I have from 15.
What do you miss most about living in Guyana?
I miss, you know, really the community with people.
Community, okay.
Yes, you know, being able to, you know, visit with people, sit and talk, you know, about stories, a lot of storytelling. So I miss that a lot. I really miss that.
You mentioned your parents and how you guys travel a lot. Is there a particular experience with your parents that shapes who you are today?
Well, I don't know if any one experience, but my parents are really, they're both teachers, and so they are also really very humble people. So just the expression of being able to enjoy what you have in the present and generous with giving to others. Both of my parents are very generous people and also very humble people.
I want to jump right. What do you think most of us don't get about healthy relationships?
Well, you know, what most of us don't get about healthy relationships, I would say, is that knowing that the impact of criticizing your partner, the impact that can have on a relationship, criticizing and also expressing contempt. So, you know, generally we express contempt sometimes when we roll our eyes, your partner says something, and I think that that's something that more and more we're learning that it's a critical factor in what would predict whether a relationship will continue to go well or whether it will go not so well.
What led you into clinical psychology?
Okay. So I would say that my grandmothers, on both sides, were a great influence in terms of when I look back now. At the time, of course, I wasn't that aware of their influence in terms of helping others, telling stories, listening to stories. When we came to the U.S. and I worked for a bit at Guyana Airways. My first year here, I worked at the office right here in Brooklyn and enjoyed that experience. But there were some, you know, traumatic things that happened there, and I left and went to Brooklyn College. I started out as a business management and finance major, and when I was about in my second year, I believe it was the first term, first semester, second year, I don't remember exactly why I enrolled in this particular course, but I took a course entitled Psychology of Women. And the professor who taught that course was a wonderful activist, community organizer, just really, really, believed not just in what you're learning in the classroom, but taking what you learned in the classroom into the community. How can we share with the community what you're learning in the classroom? And so one of the requirements was not just learning in the classroom, but one of the requirements was to do be a volunteer in the community. And so my experience was tutoring 2 young children in a local elementary school. And then this professor, Dr. Nancy Romer, also had worked while she was a teenager at a camp up in Rhinebeck, New York, as a counselor. And this camp was focused on helping young children and teenagers who had experienced emotional and behavioral problems, who were experiencing those kinds of problems. And so she, encouraged the class to also participate in that experience as well. So it was that summer I went up there as a student counselor, and my job was actually as an education counselor. And I was definitely not prepared for what I encountered there. The children had a lot of difficulty managing their emotions. It was exhausting. But it was also rewarding. And one of the things that we were instructed to do was that the first month we're there working with the children, and basically it's like 12 hours a day working from the time they're up until the time they went to sleep, we would be, working one-on-one with them, working in groups with them. And one of the requirements was that we should not read their files until we had worked with them for about a month. The experience was 2 months. And so, we worked with them for about a month and then found, an afternoon when, okay, it's your turn to go and read their files. I would say that I came away with such shock at the horrors, the terror that these children had lived with. And it just then made all, perfect sense in the way that they were having these difficulties managing their emotions, expressing themselves. They had experienced multiple traumatic events, physical abuse, sexual abuse, verbal abuse, as well as other kinds of trauma.
So that's what led you to want to do clinical psychology?
Right. I changed, I came back and I changed my major to psychology because I realized that this is what I want to spend my life doing.
Have you any regrets?
None whatsoever.
Who are some women that you admire?
Certainly my grandmothers. My father's mom was a great influence, as well as my mother's mom. My father's mom, I have great memories of her. She was always in a good mood. She seemed always to be in a good mood. You'd call her on the phone and all is well.
If your mom,
yes,
and these 2 grandmothers, were in a room telling somebody about you, and you just happened to pass by, what do you think each of them would say about you?
That's a great question. What would they say about me?
What would Mom say?
She would probably say that, I'm a quiet person. She's very proud of me. And similarly, my grandmothers, my grandmother, I think they would both be proud that in a way, I feel like I'm following in their footsteps in helping others, and that's what they spent their lives doing.
Was that very important for you to help others? I know having the experience at the camp with the young children and so on was a great trigger for you.
Yes.
Was this very important to you to help others?
It's what gives life meaning. One of the things when people experience, a significant trauma or multiple traumas, what they're robbed of is the thing that we all are entitled to, a sense of connection. And I really am passionate about helping people not doubt that they have the ability to do that, despite the fact that they have, experienced a significant traumatic event.
I'm curious about something.
Yeah.
Here's this quiet person
Yes.
that both grandmothers and mom would probably say, she's quiet.
Yes.
Here you are in this room with someone or maybe a group of people.
Yeah.
And they're having doubts about their lives, about their potential, their abilities. And you have to, well, I'm assuming you have to be assertive. I am no clinical psychologist.
Right.
But how do you transition from this shy person to this assertive doctor?
Right.
What is that like?
Well, I think it's because it's so much a passion of mine. And I really, even though I'm quiet, I'm actually quite an honest person and very bold one-on-one, right? So in the room with my patients, one of the things that I love is that they would say, I love that you give me honest feedback. I love that, you're bold, you're engaged. And the other thing that is, very helpful, and I get feedback from clients I work with, is that they talk about, you remember, the things I tell you, right? So.
What is would you say is the number one concern or reason most people or most clients seek your counsel?
Well, unfortunately, most people that I would say myself, as well as, a lot of mental health professionals, see people when they have been using all the coping mechanisms, all the coping strategies that they know how to use, and they've stopped working. But by this time, they're now in so much distress. And so, what we often see is that they're experiencing a lot of anxiety, sometimes a lot of depressive symptoms. They've been sad or down for a long time. They have lost pleasure in life, and it's now affecting their relationships. It's now affecting their work, their ability to be productive. So that's what I would say.
How long, you're in private practice, how long have you been in private practice?
Well, I've been in private practice for about 10 years.
10 years?
Yes, but mostly part-time. Okay. I was actually working full-time as a clinician, mostly in a hospital, and also as part of a research team. So I was working for about that same time, 10 years, on a research team that was looking at interventions for women who had experienced interpersonal violence. What I realized for myself is that while I like research, I don't love it. Like, I'm not,
So what are you passionate about?
Passion is really the clinical work, the activity of helping, one person at a time, or a couple. So I transitioned into full-time practice really only about 2 years ago. So
what is that like?
The
working, having a private practice, working for yourself.
Okay,
What?
so that's actually a great question, because it's realizing that it's not just the clinical work,
Right.
but now I'm a business owner, right? And that's been both exciting and also anxiety provoking. That's been quite a challenge, because one of the things that we don't get a lot of in graduate school is really, how to go into business for ourselves, how to create a practice. So there are things like money that needs to be discussed, systems that you need to put into place. And all of these things, in addition to being a clinician, have been, both a challenge but also exciting.
What do you find most challenging about it?
I would say, just the idea of creating this business, but also balancing that I'm first a clinician.
So I would say you have a very busy life.
Yes.
How do you balance work with family, or time for family, leisure, and friends? How do you balance that?
So I make sure it's a challenge, right? But I try to make sure I maintain my connections to my immediate family. So my husband, my daughter. I spend, most of my time that I'm not working with them, but we're a very close family. My parents, my sisters, my aunts, uncles, cousins, we're a very close family. And that is something that you asked about before. That's one of the things I really miss about growing up in Guyana, that we spent a lot of time very enjoying each other, and now it's a lot more challenging. So I would say yes, it continues to be a challenge, but yeah.
Well, let me ask it this way.
Yeah.
You've worked with diverse populations that include individuals who abuse substances. What can you tell us about some of your involvement in those cases?
Okay. So one of the things I learned being on the research teams that I mentioned is this idea that, a person will develop a problem with alcohol, so misusing alcohol or misusing another substance. And what we found with the women that we worked with was that oftentimes the traumatic event preceded the alcohol problem or the other substance use problem, or both. So in other words, they are misusing alcohol and other substances to medicate the pain as a way to cope with the trauma. So that's something that research and clinical work is beginning to understand more and beginning to highlight as a way of understanding.
Being Guyanese,
Yes.
what are your thoughts on the suicide epidemic and the increase in violence in Guyana in recent years?
Yeah. Very, very worried about it. And, would love to be able to collaborate in coming up with strategies of how best to cope with the growing problem. It's a significant problem, and taking what we know from research and work here would be a great way to be able to help collaborate and share resources with how to deal with the problem. Of course, we would have to look at the unique factors that are present in Guyana, but also what is it that we can use that we've already learned how to address this problem.
You've had experience with dealing with 911 survivors.
Yes.
What was that like for you?
9/11 survivors, yeah. Well, I would say, it's very challenging to work with any survivor. And, dealing with helping them find effective ways to cope with the symptoms that they're experiencing. So I would say that